Hi, I'm Tracy, and my policy paper is going to be about rural hospital closure. So, for this presentation, I'm going to talk about the policy problem, the background, the alternatives, and the criteria that I'm going to use to evaluate the alternatives. So, first, the policy problem. Across the US, more than 120 rural hospitals have closed since 2010, and there are currently 1,844 rural hospitals. So the closure of 120 of them over 10 years is a substantial hit to the rural healthcare system. As we can see in the graph, the number of closures has steadily increased over the past 3 years, and rural hospital closures hit a record high in 2019, with 19 hospitals shutting down. So the impact of the closure of rural hospitals might include significant decrease in medical admissions, decrease in economic well-being, and higher mortality rate. And the possible causes of the rural hospital closure might be states have not adopted Medicaid expansion, low patient volume, and also economic pressure. So about the background of the closure of rural hospitals. In 1946, Congress authorized the Hilburn Program, which provided federal funding for construction of public and nonprofit hospitals in rural communities. The program led to a significant increase in the number of rural hospitals in the country, particularly in the South. And then in 1983, responding to significant increases in Medicare hospital spending, Congress mandated use of fixed reimbursement rates for hospitals. In 1987, the Federal Office of Rural Health Policy was established to advise Health and Human Services on the effect that federal healthcare policies and regulations have on the financial viability of small rural hospitals and access to healthcare in rural areas. And in response to growing concerns over rural healthcare access, the Centers for Medicare and Medicaid Service implemented the FLEX program in 1997, which authorized payment of inpatient and outpatient services on a reasonable cost basis for hospitals designated as critical access hospitals. So the closure trend slowed for several years following the adoption of the FLEX program, but it was picked up again during the Great Recession of 2008. So here is the first alternative, which is the status quo. I will talk about two current programs to deal with this policy problem in the US, and they are the FLEX program that I mentioned before, and also the Vulnerable of Rural Hospitals Assistance Program. So for the FLEX program, the FLEX program supports critical access hospitals to promote quality and performance improvement, including stabilizing finances, integrating emergency medical services into healthcare systems, and incorporating population health. And for the Vulnerable Rural Hospital Assistance Program, it provides targeted, in-depth assistance to vulnerable rural hospitals struggling to maintain healthcare services with the goal for residents in those rural communities to continue to have access to essential health services. However, natural trends might be affected by the political election that's currently happening in the US and also changes caused by COVID-19. So the second alternative is going to be about changes in Medicare payments. So the changes in Medicare payments can be divided into two categories, which are base payments for services and supplemental payments. So for the base payments, Medicare pays critical access hospitals and some other types of rural hospitals on a cost basis. For small hospitals that serve a low number of patients whose costs are difficult to predict, cost-based payment can help ensure that the facility receives enough funding to maintain its operations. And for supplemental payments, several states target Medicaid supplemental payments to rural and critical access hospitals. The two largest types of Medicaid supplemental payments to hospitals are disproportionate share hospital payments and upper payment limit supplemental payments. And the third alternative is the swing beds. So as I mentioned before, one of the main causes of the policy problem is the economic pressure. So swing beds might be able to relieve the economic pressure on at-risk rural community hospitals, so it might be able to prevent rural hospitals from shutting down. And Swing beds are specially designated beds that can be used to provide care to either acute or long-term care patients. So through the use of swing beds, patients who might otherwise receive care in a nursing home can utilize the hospital. And I will evaluate these three alternatives using the criteria of efficiency, financial viability, equity, and policy sustainability. And these are my references. So that's all for my presentation, and thank you for your time.